You give that to David.
There you go, you can
And
sign
Dave,
in, 'cause
if you
you're
wanna
gonna
give
get
it
done
to
something
Mr.
today.
Guerrero when he comes.
Well, that's what I said too, like
That's
boat parade and
continuing it.
fireworks, that's
Terry's
6
gonna do a
months.
little thing on West
Coast Guard
Valparaiso.
permit.
Thank you.
You
So
can't just say,
anyway,
okay, well, now we can,
Yeah, people think. It's a blast.
Yeah.
Zip, zip.
okay.
So, I'm still working on medical freedom. Sounds nice until you realize that.
What they are.
So basically, well, yes, we have big things that this bill does.
Yeah, we don't have to move over.
It's just nice to see faces again.
She moves everybody down.
All you gotta do is take the box and move it
To have a
into
word.
the room, or get another box. It's this big.
All these patients that are new patients to me that I've never seen their face.
That's my home
And
video
now,
cam
like,
from
your
COVID.
vaccine commission asked me. And I'm like, oh, that's what you look like.
Have them call me.
Yeah.
So we are,
I don't understand that angle of discrimination at all.
Staying pictures.
Throwing any words at it, yeah.
okay, folks, we're gonna go ahead and get started here. You can hit that. Okay. Make sure we are live and broadcasting. We are. Great. Okay, welcome to the July 21st, 2021 meeting of the Ashtabula City Board of Health. Chris, could I have you call the roll, please?
Absolutely. Jim Tibanier,
Here.
David DeGeorge,
Here.
Maria Fowler.
Here.
Terrence Guerrero. Christine Seifert,
Yes, present.
Ruth Simon.
Present.
Okay, thank you, and we do have a quorum. First, I will entertain a motion to accept the minutes from our June meeting.
I'll move. Oh,
Got a motion by Chris, got a second by Ruth. Any further discussion? All in favor?
aye.
Any opposed? Motion carried. Okay. First up, environmental health report. Terry, you'll have to turn that mic on when you get up there.
Can you hear me?
Yeah, we hear you.
Okay, the environmental health report for June. The first page is the inspections for the month. It was a busy month, lots of trainings and inspections. Some vending inspections, mobile inspections, pool inspections, temporary inspections.
Okay, any questions on inspections? No? Okay.
Were there any problems with any of the inspections?
Let me. No, they were all, routine inspections. Nothing out of the ordinary.
Terry, the juice bar on Center Street,
Yes.
that's gonna be located where?
It was just, where did the juice bar? The juice bar was a plan review. We gave them, basically the first visit with the plan review packet for her if she's going to make her juice bar in that Castle Block building.
Oh, okay.
So I haven't gotten any plans back from her yet. And I did hear some hearsay that maybe it was a no-go, so.
Okay, thanks.
Chris? Hello?
You're on.
So I would just like to say, I saw a little chit-chat on Facebook over the weekend about a fella that does some barbecue. And it was nice to hear him say, I've got all my inspections, I've got all my whatevers. And yes, Terry came out again. And it's like, yep, that's our city health department at
Yes.
work.
Yes, I did.
Thank you.
You're welcome.
Jealous.
I guess,
Or
must be. All right, and
Okay,
then
anything, just looks like a few,
a few
nuisances there.
nuisances, some solid waste.
I have a question about, when I reviewed last month's nuisances report, the same address, it said Poison Shumack, and then today it says Poison Ivy.
Yeah, I can't tell the difference between the two,
Okay,
so I lumped them kind of together. So I just wrote poison ivy, same place, Same
Does-
stuff.
Does poison ivy, is that I don't recall seeing that on a health department report.
Yes, well, it's been a long time, but I had been at this certain place before. It's been maybe over 5 years. The particular gentleman that lives there is blind, so he can't, as he's trimming his vegetation that keeps growing onto his fence, he can't tell what it is until he ends up in the hospital with poison ivy or poison sumac all over him. So the property that the stuff was growing on, he sprayed with the weed kill and killed all the vegetation back so that it wouldn't be on the fence anymore.
I have a question. Getting back to the COVID, now that the vaccinations are out, and how are you handling people who haven't had their vaccinations? Which, it's not a mandatory that they wear a mask, is it still, or just suggested?
It's a recommendation. If you're vaccinated, of course, you can go without indoors and outdoors. And the unvaccinated coming indoors, they still want you to put your mask on.
Is it
But
mandated?
it's a recommendation.
Right, okay, so I can't enforce that.
But each store may make their business as strict as they want. So if you as the store, the restaurant operator, you want them to put a mask on, you have every right to say you must wear a mask if you are not vaccinated.
So it's an honor system type thing anyway, because they're not going to admit the fact that they haven't had their vaccination. Those who haven't had it
Right.
are pretty strong against it anyway,
Right.
so, okay.
But you could also make or you could also make it for your particular establishment. If you wanted everyone to wear a mask regardless of vaccination, you could also do that.
That's not for the ones who have been vaccinated.
Correct.
But I will also say that because of the Delta variant, I read recently that they might recommend that those of us who have been vaccinated go back to wearing masks indoors as protection against the Delta variant. So, you could, and so businesses could probably use something like that. But I agree with Jim, if you're like, the easiest way to do it is just to say, everybody that comes in here has to wear a mask.
It's going to be hard to do that, I think.
Yeah.
Yeah, I think, unfortunately, with all the back and forth and all the, one day we are wearing them, the next day we're not, and that kind of stuff, it's hard to, if there would have been a concise leadership at the top, we probably would have avoided a lot of the confusion in this as we went forward. But it is going to be interesting to watch the Delta as it gets in, especially with kids under 12 that aren't able to be vaccinated yet. And when we get back to school here, I've already seen some districts that are saying regardless of vaccination, they're going back with masks. So I haven't seen anything locally. I know I've seen it on even in Northeast Ohio. I think Cleveland City Schools was the latest one to say that they are going to wear masks when they go back to school. But we'll see. I mean, we'll see how it goes.
You guys watched the basketball finals last night? You see all the people with no masks?
Yep.
That'd be 120,000 people,
I think they said there were 65,000 outside.
Yeah.
So,
no masks.
okay. Anything else for environmental health?
Oh, and then the last sheet is a summary of the West Nile virus activity, positive test results for the state. I was just going to go over that. Chris, did you have them sign their CEU form already?
Yeah, they've signed it, so they understand this is a deep dive, a little bit more information about the West Nile virus, and it's part of their continuing education, so.
Yeah, okay. So the first chart is a summary of all the mosquitoes submitted to the state for testing and the locations with the positive mosquito pools of West Nile virus. So you have Franklin County with Franklin County Health Department had 7 pools, and Columbus City Health Department had 4. Down in Hamilton County, Cincinnati Health Department had 1. And in Toledo, so Lucas County Health Department had 5. So total of 17 pools thus far this summer year for positive for West Nile virus. There's been no human cases of West Nile and no human cases of lacrosse.
How come we're not on this list?
I just sent mine in a week or two ago, so It didn't get on the list yet. Next time it will be on. Yeah, and they haven't notified me yet that I had any positives, so they usually, if I do have a positive, they call and notify me right away. And then the next sheet is a flyer that we do have available in the health department, as reminding residents to, do their part and to prevent mosquito-borne diseases by making sure you have no standing water at your yard, emptying out buckets of water, tires, if you do have tires without rims, bring them indoors and cover them up, take them to the recycling, get rid of them, so that they don't pool water in that. Bird baths, you can empty your bird bath and every week and put fresh water in it is the optimum thing for the birds, I would hope, for fresh water, and then the mosquitoes won't be breeding in that water. And I also wanted to let you know that I still have the mosquito larvicide dunks available for the residents who want to put a little tablet into their bird bath, their rain barrel, anything that they, ornamental ponds that they hold water and that they can't empty it and clean it every week. They could put these in and it will kill any of the mosquito larvae in that water. And they're free to anybody at our department. And then lastly, there's been some talk about some birds dying in Ohio. And there was an article in the paper. ODNR is investigating about what's happening with our birds. It's numerous sightings with them bending over, flopping on their sides, and lack of clearness in their eyes, and discharge, conjunctivitis, and then, death. The ODNR spokesperson said that it's concerning, and that they are sending specimens to Wisconsin to do testing to find out what is exactly happening to the birds. And it's mostly seems to be in crows, blue jays, grackles, European starlings, and a couple reports of mourning doves. And if you do see a sighting of a bird experiencing these symptoms and dying, you can call 1-800-WILDLIFE to report any of the sick and dying birds. They do recommend keeping your kids and pets away from these sick birds, and that you do remove them, wear your gloves, properly dispose of them, don't handle them with bare hands. They also encourage residents to take down their feeders and bird baths and clean them. So if it's something that's coming from those sources, they want to get that out of the area so that they're not continuing to be exposed.
We're not testing them then, correct?
Yeah, the Wisconsin is doing the testing.
I mean, so we're not captured like we did?
We're not, no. But they would like to know if you did see something to be notified of it, so they know where it's occurring. Okay.
And I guess the tie-in to West Nile virus is,
The symptoms are not, the symptoms combined with the symptoms that they're experiencing are not a West Nile virus total symptoms. It's, how do they say, there's too many other symptoms to be West Nile.
right, and I think.
It does have some West Nile similarities,
Features,
but
yeah.
not totally.
Right, because they might be able to explain it, that way, but the conjunctivitis is also unusual, I think.
Yeah.
So I think they're just trying to figure it out. Birds are just like anything else. They get viruses and bacteria and funguses and so on, so.
Yeah.
I guess I'll let the record show that Terry Guerrero has entered the meeting. Terry's just giving, was just given her report, Mr. Guerrero, and given us kind of some continuing ed information on West Nile virus. We've had a couple citizens send us some emails, following up on the articles that they've read or things they've read on the internet, and, we've given them this, this information and the phone number to call. So, we'll just see what the late summer and the fall brings. But we do pay attention to what the wildlife's doing, so.
Okay, thank you for that.
Any other
Uh,
questions?
Anything further for environmental health? Motion to accept the environmental health report. A motion by Ruth, second by Maria. Any further discussion? All in favor?
Aye.
Any opposed? Motion carried. Okay.
Thank
you,
you.
Terry. Next up, our nursing report.
Okay, you should all have hopefully a copy of our report in your folders. As you can see, total COVID-19 vaccines that have been administered through the end of June were 5,966. We do now have Pfizer available. The county health department has been transferring small allocations to us as we don't have the ultra-cold freezer. So when we receive the Pfizer, it can be in the freezer for 2 weeks, and then it comes to the refrigerator for 31 days. So when you order it from the state, it's a large volume, and we obviously don't have those numbers. So they've been giving us, 30 doses here, 50 doses here. So it's nice because we're able to have it available at all the clinics that we're doing, have all 3 vaccines. Communicable diseases are noted there. And on the back, we're still doing some employee factory-type clinics where we go out and get their staff. Some are offering incentives, which I think is helping the numbers. We did partner with the county health department to do a vaccine clinic, which was targeting the teenagers at Edgewood Church of the Nazarene in front of the mall there. It wasn't a hugely well-attended clinic, but, if it's 15 kids, it's 15 kids. We also partnered with the other 2 health departments, UH and ACMC, and did this big mass community clinic at the mall. We've already done the second doses, and that averaged about 50 people. Some were first doses, some were, second doses. We do survey at the clinics when we go back for second doses to see if, their location is appropriate, if having a walk-in is appropriate. And I don't have all those data. We're still crunching those numbers, but we're trying to provide those surveys at every second dose clinic to get some feedback from the community on what's easiest for them. Would they rather make an appointment? Is it easier to come here? Is it better to be in a setting like the mall? And it's interesting when you see them of why they were there. Did they hear about it through Facebook? Did they hear about it on the radio? Did they hear because they just drove by and said, oh, hey, today's the day we'll get our kids their shot. So it's kind of helping us with a little bit of our marketing strategies on how to get the word out. We also did the one on Bridge Street where we did our first incentive for vaccines. Everybody that came to the clinic got entered into a drawing to win Bridge Street bucks. I don't imagine people came just for that, but it was a try. The state has approved us now to be able to provide financial incentives, but it's through a grant. I'm not sure. We're sub-grantees through the county of whether that will be something we will be able to offer, but some are offering $100 Visa gift cards. Like Columbus has noticed a great increase when they offer a $100 gift card to get vaccinated, so I don't know if that's something we'll be able to do here in our community. That's about it exciting-wise for vaccines. We also are precepting 2 ATEC students. The second one's coming
The
August.
22nd,
August?
August 22nd.
Yes, in August. So it's, it was nice. We had a clinic the one day. One of the students was here, so that was helpful for them to kind of see that real-world experience. And We also, and I'm sure Chris will touch on this when she gets into the accreditation, but we had some chaw and chip planning meetings and who we're gonna go with and all of that type of stuff, because accreditation doesn't stop just because of COVID. So we still have to do our community health assessment, our community health improvement plans, all of those things. So we're getting the ball rolling for that. Any questions?
I was just gonna chime in just a little bit too, to some of those clinics she mentioned. The mall clinic, you know, that was a pretty big effort. It was Ashtabula County Medical Center, UH Hospitals, Geneva, Conneaut, all 3 health departments. And I do want to thank the schools. I think that they were helpful. We put out, the committee, the planning committee, put out written information about the clinic and sent it to the schools, because there were quite a few kids that were doing summer school this year. So we thought, let's get the information to the family that way also. And then the schools did a, what do you call it, robocall? A robocall, to let them know that, you know, hey, if you've been waiting for the time this summer to get your child vaccinated, age 12 and older, there's a clinic going on at the mall. So we had quite a few people come, and when they did fill out the survey, they said, we asked, how did you know about the clinic? You know, we give them the choices of Facebook and word of mouth and blah, blah, blah. But many of them said that robocall was key in knowing. So we appreciate the schools helping us with that.
Yeah, and thankfully, we have Angie who can help translate. We have, you know, all of the information available in Spanish, as well as the, you know, demographic forms that they fill out. But it's, you know, much easier to have someone who speaks their language, if they're primary Spanish speaking, to have someone communicate with them. And we did have Hispanics at both clinics, and it was nice to have a translator available and there. I think that, you know, makes them feel more comfortable.
And at the, you know, Peggy's talking to you about the surveys we've been doing with our second dose recipients, and we'll have that data for you soon. But when we did the community clinic, we developed a special survey, and we'll have that data for you too. Those questions were a little bit different
Right.
angle than the questions we were asking. So it's always good to get that feedback. You know, what could we do differently? You know, did this clinic meet your needs? Would you advise you know, family and friends to come to a clinic like this? You know, just trying to understand how we can offer the vaccine in a different way or a better way to keep people wanting to come get vaccinated. So I don't know, Peggy, if you want to talk a little bit about meeting with the schools. And
Yes, we met with Ashtabula Area City Schools Monday to kind of talk about some, you know, back-to-school planning. And like you had mentioned earlier, David, we don't have the authority to mandate masking. So we certainly, you know, and they understand that our recommendations are to follow the CDC's recommendations. If you're not vaccinated, you mask. It just then becomes a policing and a discipline thing. I mean, how do they know in the upper grades, the high school, who is, who isn't, you know? And one of the factories that we went to, one of the methods that they did, because they didn't want to violate anybody's HIPAA, although we explained that that's not a violation to ask your staff if they're vaccinated, is, you know, they gave an incentive, but then once you were fully vaccinated, they get stickers for their badges. So the factory does require masking indoors. If someone doesn't have a mask, a supervisor is allowed to say, let me see your badge, where's your sticker? If you don't have a sticker, then, you know, then there's a possible corrective action at that point, and they mask, you know. So, you know, it's their way of kind of skirting around finding out who is, who isn't. If you don't have the proof on your badge, then you need to have a mask on. So the schools obviously are not sure yet what their plan is going to be. And like Jim said, Cleveland City's going with masks. The American Academy of Pediatrics recommends it, whether you're vaccinated or not. I think partly just due to that, you know, circumstance, or you would be able to follow every single kid in the hallway and know who is and who isn't. So it'll be interesting, and it'll be interesting to see if, you know, they said over the summer they've not required it with summer school, and I don't remember what, do you know what the attendance, a couple hundred kids?
Yes.
300?
And I
They've
don't think
not-
after-school discovery is masking either.
Right, they're not requiring it. It's optional. If you choose, you can, and they said that some students are, but we've not seen a large jump you know, but is it because the volume's down, you know, we
Is it
don't
because
know.
it's summer? We just,
Right.
you know, we don't know. One thing we do know, we're waiting for Ohio-specific guidance. So right now, we've got guidance from, you know, the CDC. And what that guidance looks like, it's pretty much what you know, what you might think. They recommend that layered strategies of distancing, although the distancing now can be 3 feet instead of 6. 6 is optimal,
In the school
but they
building.
understand these school buildings are not made for that, and, you know, they want the plexiglass, they want the masking. If a school should choose not to use those strategies, then I think the parents need to be aware, and that if there is a case in a classroom, the potential for quarantining that entire class is there. If those barriers are in place, then we wouldn't have to quarantine them per CDC guidance. So, you know, all of those things have to be considered. It's a lot of things to think about, and the good and the bad, and, you know, I'm sure there'll be parents on one side of the issue and parents on the other side of the issue. And I mean, if the goal is to keep the kids in person in school and offer them, get them caught up on education, because I've heard that, you know, they're behind, and it's not surprising, you know, it was a tough year. You know, then the choice to mask and do the strategies to protect will keep that quarantine at bay. And even the kids that, you know, are playing sports, you know, we had that last year, where if they didn't, you know, have the masking or whatever, we had to quarantine, you know, entire teams. And it just takes them out of the game, and that's not what we want. But, and the other thing they want the educators to consider is taking it maybe just up, not saying this is going to be the policy for the entire year, saying maybe the first grading period, we're going to do this, and then we're going to look and see where's Ohio at with COVID spread. Because, you know, because of the Delta variant, we don't know.
Right, and it's hard because, I mean, the state's no longer doing their advisory system report, but we still get the data of where our county's ranking compared to others in the state, and then we're still doing the wastewater, but that's all, you know, old data, so it's hard to make a decision on what you're going to be doing this week based on 2-week-old data, you know, so, I mean, and that was something Chris really tried to stress, like maybe you say, this is what we try for the first 9 weeks, if cases stay stable, then maybe let's cut back one measure and see how that goes. If we see a jump, then we're gonna put back, you know, A, B, and C. So, you know, it's gonna be an interesting school season, just like last year was, but hopefully, and, you know, even with the Delta variant, the kids are not getting as sick as adults, but it's, do they bring it home to grandma? Do they bring it home to mom or dad who has some diabetes and underlying? You know, it's a blessing that they're not horribly sick from it, but what they're doing to the community also has an impact, and I think sometimes people forget that next step in the course of how diseases are transmitted. Any questions?
Anything else for our nursing report? Okay, I will entertain a motion to accept the nurses' report. Moved by Chris, second by Maria. Any further discussion? All in favor? Aye. Any opposed? Okay, motion carries. And that brings us to the Health Commissioner's report. You are up, Chris.
Yeah, I don't know, Peggy, you want to come back up to the microphone? So we wanted to give you an update on our FAB accreditation. So several things are happening. We did hear back from from the FAB board, and the request that we had put for an extension to respond to our pre-site visit was granted to us. So that's fantastic news, knowing that we have a lot going on. So we do have to unpack some things and respond to our pre-site visit, but we technically have till 6/22 of '22 to get that, you know, together and prepared. Of course, we'd like to do it tomorrow and have it off our plate, but we're trying to be realistic with what's going on in the health department. I don't know, Peggy, if you want to talk a little bit about the pre-site visit measures that were reopened.
Yeah, I don't remember the exact number, but in each of the different domains, there have been things that they kicked back. Essentially, they want what we submitted to either be differently identified or submit different examples. So we're going to have to go through each and open every single document that was submitted, see what they've identified as a reason why they didn't find it acceptable, either hopefully fix the problem or find another document to submit. At that point, once we get all that sent back to them, and again, thankfully, we have a whole year's time, normally it's a few months, then they will come back again and review those things. Things that we have not fully demonstrated according to their scale are things that they're going to discuss with us in person, and a member of the board who needs to be at the site visit too. And it might be virtual, we don't know, a year from now. They're still doing them virtually right now. But those are the types of things that they're going to reopen when they come for the site visit and say, you know, access to care is a problem with everybody. Everybody gets dinged in domain 7. So they're going to, and thankfully, again, we can use COVID documentation. It's outside of our timeline, but they're allowing that. And we have really, because of the knowledge of FAB and what FAB wants, that's really been an area that we have focused on when we've been doing our outreach. That's partly why we did that pop-up testing clinic. You know, we're going to these social vulnerable index identified areas in our town. So we're going that extra mile now to show that we're reaching out to provide that access to care for people that aren't necessarily getting it elsewhere, or, you know. So I think that, you know, having that information is helping us as a health department provide better public health services to the people that we serve.
I agree, and I think the other thing, the entire staff, I have to, you know, thank them, because they've upped their game to a new level, because it's about documentation. I think we've always done what FAB expects of us. We have not always been good about capturing it in documentation. So we've upped that game. We understand what they need as proof to show that we did what we said we were doing. So, you know, we've become very, I think, very good documenters, and like Peggy says, we're always aware of, you know, of the highlights and what we need to be looking for, and what we should perhaps prioritize that we do. So that's our update on accreditation. And then the next bullet point on my agenda is the chip and chaw. So the chip and chaw, if you guys recall, I'll just give you a little quick refresher. The chaw means community health assessment. The chip means community health improvement plan. Okay, so you do the assessment first, take a look at what needs improved, much discussion, much research, and then you try to prioritize what you're going to try to fix in the coming
3 years.
Yes. So it used to be that we did the chips and chaws on a 5-year basis, and then the law changed, and we have to do it every 3 years, and we have to do it in alignment with our local hospitals. So that is what we're doing. And so our 3 years has just flown by. And sadly, 1 whole year of our 3 years, or a year and a half of our 3 years, was wasted to COVID. I mean, we really couldn't go out and do a lot of the things. We were able to do some things even through our COVID response, but to really do our community health improvement plan like we wanted to, it was sort of put on hold. And, you know, I think everybody understands that. So we did have to pick a new vendor to conduct the CHAW. And so we went to our original vendor, who we've worked with for several cycles. Their prices have gone up so high, it just was cost prohibitive. So we reached out to a couple, 3 or 4 new ones, and through virtual meetings, we interviewed them. We gave the vendors a chance to pitch their product, pitch how they were going to do it, what the costs were, and that's what's in your packet if you take a look. But in the end, the committee, the Community Improvement Committee, voted, and Illuminology is the company that we decided to go with. And I'm very happy. This is the one that Peggy and I voted for also. They are an Ohio-based company. I do like to keep things in Ohio when I can, and locally when I can. They have worked with many Ohio Health Departments who are accredited, and I liked that, because a big part of accreditation is the chip and chaw. So I think they understand what's needed. be demonstrated. So we also had approached the final couple companies that we were interviewing to ask them, so the chip and the chaw are done for the entire county. But we need a little bit deeper dive or a little bit more focus put on city-specific information. So we have to always pay a little extra money to have city-specific information brought forward. So we asked both the two finalists to give us quotes on doing city-specific information. And Illuminology did give us a quote. If we utilized everything that they had added up for us, it would be $3,560 for them to do the city-specific information. So I thought that was a pretty fair quote, and of course we will also financially contribute to the overall chip and chaw. So we haven't had those discussions in detail yet, but we did name Illuminology, and like I said, I'm happy. I like their approach. I don't know, Peggy, if you want to talk a little bit about surveying.
One of the things that is an option is now doing a virtual survey, or like a Survey Monkey, which obviously at times have changed, but everything was paper previous. We sent it out. We sent out a $2 bill. We sent reminders, and a lot of the cost was honestly in mailing, because you're sampling size and all of that. Both of the or all three of them, now have a virtual as well as paper option, or combined, and we're agreed as the Community Health Needs Assessment Committee has agreed to do a mixed type survey, because we know South County doesn't have internet access the way, and again, we need city-specific data for us, but as a county as a whole, we need to get everybody's input, and so having that mixed availability to provide the survey hopefully it's going to increase our numbers. I mean, last time we did it, to get our city-specific data, I mean, we had like 3 people extra to meet our quota of what was needed to have statistical appropriate information. I mean, it was like, I think 3 over. I mean, we had just made the cut for them to gather the data and give us that number. So hopefully we'll get a better response by having both. And then they're also talking about, we held focus groups like at the library, we held them here to get one-on-one data from people, and that's something that they're going to be able to help us with, set up these focus groups, get more data that way, which will help with the surveys. They also obviously want community leaders, Board of Health, all of that input. So when we get closer to that, we'll certainly let you guys know what the link is, and hopefully you'll all agree to take the survey.
Peggy?
Mm-hmm.
I thought when these went out before, they went out randomly. I didn't think they were available to everybody.
And that was a good question, thank you. Chris and I were talking about that, we're like, is it just our listserv of people that we have? And so they are able to do, through some company, do a randomized sampling electronically, and I don't remember the details on how she did it. It was random based on our county. They use some service through the mailing systems or whatever to get addresses, but they're able to do the electronic kind of similar, they'll put a link out there on different, because that's what I said, that's not very fair if I send it to all the people that are on my email address. They're all public health related people. They're going to answer differently. But she said that they'll target certain areas, like they may go to a laundromat and post the link there. They may go to certain food banks or different things like that, have those links available. And I'm not sure if we will be able to do that in the rural areas, but have someone there with a laptop that can help you do the survey. So you are still getting that, randomness throughout your community and getting that information.
So it's still selective. Only certain people can fill it out.
I honestly don't know if we'll have the availability to say, here's the link, do it yourself. I don't know.
It would seem like if there was a Survey Monkey that you could kind of open that up.
Right, I know, and she had mentioned maybe QR codes available, that if you're at McDonald's, you would just scan it and get it. We didn't get into the true nitty-gritty
We're going to have
piece
some
of it.
organizational meetings, and I think we'll be better positioned to answer some of those detailed questions
Yeah.
after that meeting, but.
Because that was a concern,
Yeah,
how
But
do
I
you?
did like the hybrid model, where
Yeah.
it's not all electronic survey, because I think some of the most vulnerable people that we want to reach out to are not going to do an electronic survey. So the paper surveys that would be available at a you know, a food bank or a laundromat or a, you know, pick a place, you know, and even South County with the Amish that don't have access to, you know, electricity and things like that. You know, just it's for this county, it felt like a better fit, so.
And
but
with our
yeah,
fab
Chris will
hats
follow up.
on, we wanted to make sure it was in English and in Spanish. So
Yeah,
they
oh,
said they could
absolutely.
accommodate that as
Yeah,
well.
that was one of the questions we asked them, so. Yeah, so I'm excited to be working with a new vendor and, you know, we'll,
And there'll be
you know, but we have to start by
COVID-specific
wrapping up,
questions,
we have to start by wrapping up the old chip and chaw and kind of saying what progress did we make, if any, and what kept us from making progress, and then kind of buttoning that up and then turning our attention to a new one. And you know, the problems may and probably will be a lot of the same problems. They don't go away, that the needle moves very slowly, you know, so we'll see what happens. Okay,
Okay.
any other questions for? Okay. All right, I'll move on to the financial report. That is before you. Not a lot of anything exciting to tell you financially. I did want to let you know there's a couple things happening. The FEP grant, which is, FEP stands for Public Health Emergency Preparedness. We've been part of the FEP grant for a long, long time, and it's changed its name throughout the years, and the amount of grant funding has changed, and the way it's been administered has changed. But the bottom line is, it's funding that comes through. It's one grant per county, and it, of course, will go to the largest health department if there's competition. And so we've never applied for the grant. The county health department has always applied for the grant, and we've worked with the county in preparedness. What is changing this year, Jay Becker is the new health commissioner for the Ashtabula County Health Department. He had a meeting with me. He feels very strongly that we've always been given a stipend payment, a little bit of money from the grant to just kind of help offset the amount of our, you know, of our hours spent on grant deliverables, on gasoline if we have to drive to meetings and things like that. And we've always signed a grant agreement with the county that outlines, we'll give you this money, we expect you to do A, B, C, and D. Now we will no longer have a grant agreement. We will just verbally agree to help with the deliverables that need to be achieved for the grant. They will keep the money, but we will do our part because it's the right thing to do. Preparedness, if COVID didn't highlight how important it is to be prepared, I don't know what else would. So anyway, all of that is different than what we've normally done. And, you know, I just think that, you know, we have no hard feelings over it. We appreciate their leadership in the FEP grant. They provide, through FEP grant funding, an epidemiologist that covers all the population of the county. And they provide a emergency preparedness coordinator. Part of her salary comes from this grant. So we appreciate that. And, you know, they hire those folks, and they will include us in on drills and, you know, things like that. So, you know, I'll keep you up to date. This is new. This is different. You know, the good thing that's happening, the meetings are going to be virtual. You're going to have that option, so I won't have to drive. If I want to listen in on a meeting, I can, if I have the time in my calendar, I will do it, and I'll do it virtually. So you know, this may all just work out just fine. I'm hopeful that we'll have the same type of preparedness that we've always had, despite the fact that we won't be getting the stipend.
Is there a reason why we're getting squeezed, or they just out of the blue just decided they don't want to fund us anymore? Or, I mean, this doesn't sound very fair to me if we still have to do the same amount of work and we're not going to get any money for it.
Yeah, I think that part of the decision is that it's the change in the leadership. Ray Saporito always felt it was important to provide a stipend to us. Part of that, just, the goodwill thing and whatever. Jay Becker, who's the new commissioner, I think has just a different philosophy. He realizes that we have to all work together on this, and it really isn't that large of amount of money. So I just think that he.
Well, how much is that? I mean, what
It's under 3,000, 2,800 and some. And through the years, it's been different amounts. So, and I also think what might be driving their decision is they have gotten less money. So, I will keep you guys updated though, because I do hear you, Mr. Guerrero. It's something that you want to keep track of. We did check with the state and ask if this is allowable. Are they mandated to share the money of the grant with us? And they are not. They are not. That is absolutely optional. And talking with some of my colleagues that are city health departments or in counties that have multiple health departments, it can go either way. Sometimes money is shared like it's been in the past, and sometimes there's no money given to other health departments. So we'll see how that goes. But like I say, I value the preparedness piece of it. So we'll just see how things go. So I want to tell you about that. And if there's no other questions financially, I will move on to the COVID response report. In your packet, there's a summary of the statistics, the latest statistics. For Ashtabula City, we have a total of positives, a total cumulative positive count of 1,485 individuals that have been tested positive. We have no current hospitalizations. We have a cumulative hospitalized count of 100. We have a cumulative death count of 32. We don't have any current deaths. Actively, our cases are at 7 this week. Last week it was 2. So we are trending a teeny bit up. Symptoms resolved, 1,440 folks. And to county-wide totals, we have 7,438. Hospitalized, 567. Symptoms resolved, 5,470. 193 folks have passed away, COVID-related cases, and active cases countywide is 20. So, we are keeping a close eye on the numbers because of the Delta variant. It does spread, takes less virus from one person, from an infected person, to a non-infected person to get a person sick. It's more virulent. It's more the departments remain very busy planning for and setting up vaccine clinics. We're going to be at the elementary campus this Friday at their what is it called, Family Fun Fair?
Fest.
Family Fun Fest. So we'll be there with vaccine. We'll also be in August. We're going to be again at the high school for the back to school bash that they have at the school. We'll also be at People's Baptist Church when they do a back to school giveaway in August. So we have quite a few kind of more school focused, family focused related vaccine clinics upcoming. And as Peggy said, we continue to work with businesses and, anybody really that wants to host us, we're happy to try to come and help. So we'll just continue those efforts.
Chris, I think this year the back-to-school bash is at the elementary campus.
Oh, is it? We thought it was at the high school.
I believe it's at the elementary campus this year because
Okay.
Jen Bennell is organizing it from the deck.
Okay, yeah. All right, well, that's great. That's great. But, all that, we're just grateful to be, invited and part of that, and we'll have all 3 types of vaccines there with us and additional educational material and things like that. So, And then, we already talked to you a little bit about the meeting with the schools and the school guidance, and there's, a lot of things that have to be decided, and, summer just flies by fast, so, those decisions are probably gonna have to be made pretty soon. I did want to tell you about a contact that we had. A lady, Stacy Stangl, had reached out to us. She's from Central State University and Ohio State Extension. They'd gotten a grant, and Ashtabula County, and including our city, is one of the counties that has been earmarked for this grant, and they're coming in to do a survey. They wanted to talk to us a little bit about the survey. The survey is a survey that asks people about their vaccine preference. I can't even remember the questions. Peggy, what are they like?
About like your trusted providers in your community. Medical, do you go to your peers, do you go to your schools to get your help them with their targeting of
Yeah, I think they're trying to understand vaccine hesitancy. They're trying to understand, if you got medical advice about the vaccine, who would you get that from? Who would you trust? Who would you trust to vaccinate you? Or, and just trying to understand, I think, overall vaccine hesitancy or that type of thing. So she sent us the link for the survey. I know I took it. It's not a very long survey. It's fairly brief. But she would like to come to different events in Ashtabula and, be there to administer the survey and, just help with education and things like that. And we were all excited. We're like, yes, absolutely, come in. And, we're happy to have you. So we just sent her recently the list of upcoming clinics, and I don't know which ones she'll be at, but, we're happy to host her, and, are excited to see if the survey can shed some light on some things maybe we could do differently. So, and I think that is the end of my report. My activities and trainings and meetings are listed there for you at the end of the report. We just remain busy with a lot of conference calls and things like that. We still do have a health commissioner call with the governor every week. He takes a half hour, was an hour, now it's down to a half hour of his time every Monday to talk to the health commissioners about the upcoming week and priorities and strategies, and to hear our concerns and hear some of the successes and some of the failures we've had. And that's been nice to get that kind of support. And the Ohio Department of Health and our regional partners, we do a lot of conference calling, and that's all been very helpful. And and then here we just locally, we're starting our Zoom meetings up with the superintendents again. Just meeting monthly now with the COVID defense team. Jim's part of that. That's with the EMA, the hospitals, where we just sort of do like a situational awareness. We talk about, how the month has been, cases that we have, just what's happening with everybody. So that is, sort of where we're at right now. So that's the end of my report. Happy to take questions or comments or.
Thanks, Chris. Any questions for Health Commissioner?
I just have one quick question. It's about the testing. That number, it says that there's 3 positives from 448 tested in a 1-week period. Is that in the county?
Yeah, that's
448 county?
that's countywide.
Okay. Are you seeing the tests that are being done? Is this like mandated by your employer, or I'm going to have surgery, so I have to have a test, or are people actually going out and seeking? I'm feeling like less people are getting tested is sort of my, just in the pharmacy aspect. A lot of people have symptoms. Lots of people coming in with colds, allergies, sinus infections, whole lot of that, but very few, in fact, none that I asked, have you been tested? Because, the Delta variant, those are pretty much the symptoms they're saying, and no one of them was tested. So have you seen that to be the case? That, I mean, it's saying we don't really have that much of the Delta variant, but I kind of feel like I think maybe we do.
Yeah, that's a concern, and we try to do that education with people too, and we appreciate that. I mean, people are still getting tested for a variety of reasons.
Okay.
Preoperatively, pre-travel, some for symptoms, but is it as much? Probably not. It's probably dropped off. So, we'll see what happens. We try to continue to encourage that, that activity, but that's a good pickup.
Okay, any other questions?
I have one, a little off the subject. Are we moving?
Are we what?
Moving?
There may be a potential.
I just eavesdropped on a conversation at the bakery one day that we were moving to Lake Avenue, and
That's not true.
It's a small town.
Anything else?
Will you give us a forwarding address? if we-
Maybe, possibly. Yeah.
I think you guys will be one of the first to know.
no, I was told it was right there across from the VFW.
Anything else for discussion?
Well, I do have one other thing, and I wanted to talk to you guys about continuing education. So you know, as a Board of Health, that you're mandated to have 2 hours of continuing education every year. And, Terry just presented a small presentation to you, but I just had a link sent to me not long ago from Kent State. It's a link with free education for Board of Health members. And what it is, it's 6 15-minute little videos that you click on your computer and you watch them. Some are even a little bit less than 15 minutes. The topics range from, public health ethics to sunshine law to, just a real nice variety. And so if I'm going to go ahead and email those links to you, and, do need you to look at your continuing ed information, and then I'll have you sign off that you've had it. And that will be the completion of your continuing ed if you watch those links for me. And, we can discuss any of it when you come back for a board meeting. If you want to discuss what you've learned or have questions, we can do that. If you don't have availability for a computer, or would be comfortable coming into the department before or after a board meeting, or really any time, you're welcome to come on down to the department and we'll set you up at a computer and you can watch one or all or part or whatever. So, but I just thought I'd take advantage of those free, usually you have to pay for those. So they were free, and I was like, I think that might be a really good fit this year.
For those who have, like, continuing education requirements as a part of their license, like Dr. Bishop or myself, like, do we all, that's in addition to that?
That's
So
in
this is
addition.
2 hours on
Yes,
top of the
yes,
20
it's in addition to that. Unless
2 hours needs to be specific to public health.
It does, and they're real specific, because people ask that question, and they said, if you want to submit something that you took in your continuing ed for your licensure, you may, but it has to be specific for public health. So, but if you feel like any of your stuff met that, then you can be, excused from some time, for sure. So that's all I had, Jim.
Okay. Anything else for Health Commissioner? Motion to accept that report? Motion by Maria, second by Chris. Any further discussion? All in favor?
Aye.
Aye. Any opposed? Motion carried. Okay, we will see you all next month.
Thank you.
Same time, same place.
Same
Thanks, everyone.
station.
Thanks, everybody.
Thank you.